Kindred Hospital joins us today discussing what many of us may not know about a transitional care hospital. Heather McCarter is here to break it all down for us and help us understand. Good morning, Heather. How you doing?
Good morning. How are you? Great, thank you.
I'm good. I'm excited you're here today.
Thank you. I'm glad to be here.
Well, and you know, this is a very hot topic and really in Florida. And so I'm glad you're going to kind of break it down. So let's first start off by just addressing what is transitional care, and especially a transitional care hospital.
Well, a transitional care hospital essentially is a bridge between the community hospital and a lower level of care, meaning an acute rehab facility, a nursing home, home with home health. Basically, it's for patients that can't transition to that lower level of care yet. So just like the community hospitals, Kindred is licensed by the state of Florida as a hospital.
Okay, and I was going to say, so what does make Kindred Hospital different than the community, other than like the lower care? So when people say like rehab center, is that kind of what you're talking about?
No, actually Kindred is a hospital.
Okay.
The difference between a community hospital and Kindred is that the community hospitals, they specialize in patients that require short-term stays.
Okay.
Basically, a community hospital patient will stay roughly about 3 to 4 days, depending on their needs. But there are that small percentage of patients that require an extended stay due to their medically complex conditions. Now, Kindred, our expertise is in treating patients that require extended stays in the hospital. A Kindred patient typically stays about 24 days, depending on what their needs are. So there's the difference. A community hospital is about 3 to 4 day stay, and Kindred's about 25-day stay.
Oh, okay. Perfect way to break it down. And we're talking about patients. What kind of patients would benefit from Kindred?
Well, Kindred, we accept multiple types of patients, but I would say that the most typical patient that admits to Kindred are respiratory compromised patients, vent weaning patients especially, patients that require high oxygen flow, O2, COPD patients, patients with pneumonia, complex wound care patients that require extended wound care. That's just to name a few, but basically patients, as I said earlier, that can't be managed at a lower level of care.
You know, if a person is maybe watching this at home and thinking they know someone, or, you know, maybe I'm in that situation, how can people go and get more information so that they might see if they're a good fit?
Absolutely. They can call 1-800-KINDRED, which is a 24-hour hotline. An RN will be available to answer their call. They will be able to let them know our Kindred locations, answer any questions regarding the different types of levels of care, or any insurance questions. So it's pretty simple, 1-800-KINDRED.
What are some of your locations, just to kind of, just spark like, we need to address that.
Great question. We actually have 3 locations right here in the Tampa-St. Pete area, meaning one in North Tampa, one in South Tampa, and one in St. Petersburg.
So you've got a lot of areas covered, and I do want to just get your thoughts. I mean, seriously, you're passionate about helping the patients. Is there anything else that you would like to add to really let our viewers at home know what you can provide?
Absolutely. So one of the other main things that we like to point out to our families is that our patients at Kindred are seen daily by a physician, and they also receive physical therapy up to 6 days a week, which is a great component because it makes the transition back to the community, to a lower level of care, much easier.
Wow. Well, thank you so much. I really appreciate your time. And we want to go ahead and make sure people have the information that you can see on your screen there. So it's 1-866-KINDRED, like she just said, or kindred.com. So easy ways to get information, helping patients one person at a time.